while I was doing that with the Commissioner of Health, I noticed that my son was showing some changes. So I went to the pediatrician's office, and he said, you know, it's a phase. It's a phase. Just give him a little rope, let him hang himself, and you know, he'll grow out of it. This answer, so I started trying to find help. Now, I was the deputy director for the Office of Health Systems Management. I knew the head of Albany Med. I knew who ran Conifer Park. I knew all the doctors. They didn't necessarily want to know me. I met them through Office of Professional Medical Conduct. But you know, I knew these people. This is my world. And I'm like, there are no people in this area that are going to help me. Trying to fight. Ryan's addiction got worse. When he was a senior, he got, you know, he could have gone to any college he wanted. He had been using, I guess, all along. I didn't know it. I was at the Department of Health, and they pulled me out of the commissioner came to find me. And they were on the phone saying that we can't find your son. And I was like, what do you mean we can't find my son? And they're like, the cops, the police, the campus police, had thought that they saw him cutting again, so they ran after him. 3 of them, Allie. The next phone call I got was, your son's not breathing. What do you mean he's not breathing? Well, he was in math, which was like, you know, calculus or something. And they're like, he's not breathing, we can't wake him up. So what hospital would you like him to go to? I was like, I don't know, just get him to the closest hospital. I tried to get him into Conifer Park, tried to get him into a program actually, I shouldn't say Conifer Park. And the health insurance said, nope, we won't cover it. And I was like, what? He says, he's got to fail 3 times in 6 months at outpatient. Do you understand what failure means with this addiction? Do you have any clue? Failure is death, or the high potential for death. But while he was at Conifer Park, a couple of his buddies that he met there told him, oh, you know what you can do with those pills that you get? You can crush them, and then you can shoot them up. And he was like, I've never done that. And he's like, we'll show you. And they showed him while he was at Conifer Park. Looked into it, and I found a doctor that had just moved from Connecticut that would do Suboxone, started him on the treatment. He did extremely well. I'm sorry. He started feeling good, he wasn't getting sick, he wasn't anxious, he was doing well. But the Connecticut doctor was kind of fed up with New York State and how difficult we can be, so she went back to Connecticut. And we had no Suboxone doctor. Overdose number 2. Well, that the police are looking for me. Me? Yes. They're sending the Philadelphia police over to your house. You know, what do you think when someone tells you that? Thinking he's dead. What's going on? I said, is this about Ryan? And they're like, who's Ryan? Okay. We're calling you about Christopher Wickens. What I tell you that is that's something that's very different about this type of drug addiction sometimes. Even though some people may know that you look like you're using, there are very good addicts, long-term chronic addicts that you will never know. So we do not know. And Christopher was estranged from his father and the family. Ryan said, God works in mysterious ways, Mom. I said, yeah. He said, that could have been me. I was like, but I don't think I have the guts to pull the trigger. I took out a home equity loan, decided to leave the Department of Health so I could actually have some money, because even with insurance it didn't work. And that's one of the reasons I left the Department of Health. And I went into private service, and I also got the home equity loan, moved him to Pennsylvania, moved him to North Carolina, long-term treatment, brought him back up. He did relapse, and he did overdose one more time. But we've got 3 years now under our belt, and he's married, and he's doing well. So why am I telling you this horrific story? There's a lot of things that have been talked about today, lots of different perspectives. I started working and reaching out to the government, to the legislators, to where I worked 8, 9, 10 years ago now, and saying, we are got to do something. The other thing about this drug, some of the differences. Now, as a nurse, I've been a nurse since, for 27 years now, 27, 28 years. I know about addiction, but we don't learn about addiction, and our pediatricians don't learn about addiction, and they don't know how to do an SBRT. They don't know what that assessment tool is. I have primary care physicians I work with that don't want to prescribe Suboxone or get certified to do it because they don't have any of those kinds of people in their offices. Addictions just goes skyrocketing. That's a difference. My son had been using opiates, any prescription drug, methadone pill, buprenorphine, whatever he could get his hands on, he got. And he had been using it for years, and I didn't know it.